we're now going to talk about a new initiative in Regina called Social Prescribing. I have got Darryn Oldford beside me and McKendrick from Saskatchewan Seniors Mechanism. I'm looking forward to hearing about this. I don't know what social prescribing is.
Social prescribing is a way where health professionals who see folks in their emergency rooms, in their doctor's offices, who have had their healthcare issues addressed, realize there's more to what's causing some of that health issue, which is driven by things out in the community. And that's when we're able to work one-on-one with the individual and connect them with a community connector in the communities.
So the social prescribing, does it start with a doctor?
It can start with a doctor, a primary healthcare nurse, a pharmacist, first responders, self-referral, even family referrals.
And then you're referring to services in our community?
That's correct, yes. And we have 12 other communities around the province that are doing the same thing.
So you're trying to take the load off a doctor. Is that what I'm sort of...
Taking the load off the system. However, it's more directed at the individual. Somebody loses a partner or something, they're depressed, yes, they may go and see the doctor for depression. Yeah. However, the thing that may be causing is that they're lonely and isolated. Yeah. So if somebody's able to address that, like a community connector, then...
And then we come to you, Darryn. You're a community connector. How did you get involved?
So I have a background in senior activation and also gerontology. So I saw this position, I wanted to jump on it because I really see what we call the social determinants of health, which are all the things outside of direct healthcare that impact people's health, like their transportation, their food and nutrition, and also just social interaction with each other.
Okay. Yeah. So as a community connector, you get the call? Okay, so what happens? They've been referred to you.
Yes.
Okay, and then what happens?
So I reach out to them and we do an assessment, we do an intake, because every person is unique. Everyone has their own unique challenges. Some people just want to connect to a volunteer group because they're bored and they don't know what to do with their days. Whereas other people might be struggling with issues with finding appropriate food or needing help figuring out how to get paratransit. Yeah. So being able to support them through those initiatives and also connect them to the right community resources for them to be able to live their happiest and healthiest life.
Yeah. Are you the only community connector?
I am not. So here in Regina, we also have an Indigenous community connector who works specifically with Indigenous people 55 and up.
Okay. Is this a new program?
It is here in Saskatchewan. We started this initiative about 2 years ago, almost 2.5 years ago now. Other provinces are doing it and have been doing it for many years. And we're finding that no matter what community they're in, we've got large communities, both Regina and Saskatoon, but we've got small communities of 2,000 people in different areas of the province.
Okay. So I'd like to say, how do you get a referral? Because the referral starts with someone. What if that someone doesn't know about social prescribing? Like I'm sure there's a nurse practitioner, a doctor, someone who doesn't know about you. What are their steps?
Their steps is to make a referral. We have a specific referral form they fill out, just a one-pager because it's simple. Okay. And then they send that to the community connectors.
Okay, and can they find that on the website we'll bring up? The Saskatchewan Seniors Mechanism?
Yes, they can.
Okay, we'll bring up that website. So grab a pen if anyone's listening. How do you need more people involved in this program? As in Saskatchewan Seniors Mechanism, community connectors, or this is the pilot project, let's see if this works.
And I think that's the reality is it is a pilot. We want to see if it works, polish it up, and if it works, let's take the next steps to move it out into the other communities.
Yeah, I love it. I love just, taking that load and sharing it and getting it to the right people.
For sure.
That can help you.
And it makes a life-changing, it's really out there helping a lot of people already. So.
Awesome.
And a quick example is a lady or a gentleman may go to the emergency room because they're falling, and they may keep going back because they keep falling. They address the medical side of it, of the wound or the broken bone, but maybe the steps are broken at home. if the connector knows that, maybe there's somebody or a group of people in the community that might say, we'll fix those steps. And she doesn't then keep going to the emergency room or the doctor.
Yeah, we'll stop. All right. Well, thank you very much for coming. We're out of time. I think we could talk forever.
Yes.
I encourage more people to go to the website. All right. Thank you.
Thank you very much.
All right. Well, that is Social Prescribing Initiative in Regina. Super excited to talk about it. If you want to learn more about this, check it out. We're going to bring out a website for you to find out more about social prescribing with the Saskatchewan Seniors Mechanism. But come right back because we've got a new initiative here called Brain Gym Junior. This is cool.